Assalamualaikum, and now I would like to present to you about medical imaging in breast cancer. This is the content that I will present to you. The first one is definition of a disease. The second one is imaging modalities and the procedure. The third one is the limitation of a breast cancer MRI and a patient condition. And the last one is conclusion and self-reflection. We're going to the first one. Breast cancer is a disease in which cells in the breast grow out of control, or a malignant tumor, a collection of cancer cells arising from the cells of the breast. People may think that men cannot develop breast cancer because they do not think of men as having breast. The fact is, however, that both men and women have a breast tissue. The exact causes of breast cancer are largely unknown, but both environmental and genetic factors are involved. The most common symptom of breast cancer is an abnormal lump or swelling in the breast, but lumps may also appear beside the breast or under the arm. Other symptoms may include unexplained breast pain, abnormal nipple discharge, changes in the breast texture, or changes in the skin on or around the breast. If you start to be aware of your health, then I'm trying to recommend a few imaging modalities that can be used for cancer's detection. In this case, is breast cancer. The currently used modalities include mammography, that is commonly used for early or initial detection using X-ray imaging principle, MRI, that is using a combination of large magnet and radio waves to produce detailed images, thermography, in this case DT, are commonly used for breast examination, and the last one is PET, a positron emission tomography, is an imaging test that uses a radioactive substance to look for potential spread of breast cancer. But for now, we are focusing on breast magnetic resonance imaging. Why we choose MRI? Because MRI is the imaging technique which has the highest accuracy in identifying breast cancer. MRI is the most accurate instrument for the local staging of breast cancer because of its ability to show multifocal tumor, chest wall involvement, retraction of the skin, and lymph node metastasis. And the second one, without radiation exposure. Because radiation is not used, there is no risk of exposure to radiation during an MRI procedure. So it is safe. If there is a woman who are pregnant, are required to do a radiological examination for breast cancer. And we're going to the procedure. How does a breast MRI work? After you removing clothing and all of your jewelry, the first one is contrast agent may be injected through an intravenous line in your arm to make the tissue or blood vessels on the MRI pictures easier to see. And the second one, during the breast MRI, you lie face down on a padded scanning table. Your breast fit into a hollow depression in the table, which contains coils that detect magnetic signals from the MRI machine. The entire table then slides into the opening of the machine and the scan process will be started. The MRI machine creates a magnetic field around you and radio waves are directed at your body. You won't feel the magnetic field or radio waves, but you may hear loud tapping and thumping sounds coming from inside the machine. Because of the loud noise, you may be given earplugs to wear. And these are the results of MRI imaging in detecting breast cancer. Potential limitation of using MRI. The first one, although it has distinct advantages over several imaging modality, breast MRI also has potential limitation. For example, it is not always able to distinguish the difference between cancerous abnormalities, which may lead to unnecessary breast biopsies. This is often referred to as a false positive test result. Recent research has demonstrated that using commercially available software programs to enhance breast MRI scans can reduce the number of false positive results with malignant tumors. Thus, the need for biopsies may decrease with computer-aided enhancement. And the second one, unable to identify calcification. Another limitation of breast MRI is it has historically been unable to identify calcification or tiny calcium deposits. They can indicate breast cancer. Patient condition with special precautions. Due to the use of the strong magnet, Special precaution must be taken to perform an MRI on patients with implanted device such as pacemaker or cochlear implants. The MRI technologies will need some information regarding the implanted device, such as the make and model number, to determine if it is safe for you to have an MRI. Patients who have internal metal objects such as a surgical clips, plate, screw, or wire mesh might not be eligible for an MRI exam. If there is a possibility that you are a claustrophobic, then you must ask your physician to provide you with anti-anxiety medication that you can take prior to your MRI examination. The last one, we go to the conclusion and self-reflection. For the conclusion, breast cancer is very common among women, but men are also have the potential to having the disease. So when it begins to appear some unusual symptoms, you need to take immediate action for doing some early stage detection. MRI is one of the solutions that you can use. And for the self-reflection, at the end of the session, we're able to learn a lot about the fundamental of breast MRI that is essential to know as a biomedical engineer. Thank you.